Our NHS, Our Future Review needs to achieve fundamental improvements in the health of the population of the North West. We lag behind, we can do a lot better. We can bring our health services all up to the level of the best that we offer, and the best that we offer is great.
I suppose what we've been trying to do here is to really get the views of our clinicians and the members of the public about what's the best thing that we can do with the resources that we've got to improve the health services that they currently get.
We've had physiotherapists, pharmacists, radiographers, all sorts of people involved, and to have those people that deliver the services, that meet the patients on a day-to-day basis, to say what the issues are and what needs to happen to create the vision is a fantastic opportunity, and I think what we'll achieve will be all the better for it.
I want my family to be healthier.
We're now going to take forward in the North West a new relationship with people that starts to talk to them more about how they can involve themselves in their own health, look after themselves better, perhaps have healthier lifestyles.
Hospitals aren't going to sort this problem out. It's getting out there with the schools, with the families, exercise, diet. We need to start with families because they are where health begins.
If we can reduce avoidable ill health, then everybody benefits.
If I need an operation, I want the best care.
Sadly, we don't always give the high standards of care to everybody on every occasion. So we've developed a programme called Advancing Quality, which checks that all the best clinical standards are being applied every time for everybody.
I need convenient healthcare to fit in with my busy life.
I think one of the key things we want to achieve is to give people care when they want to access it rather than when we plan to give it. I use doctors, I use health services, I'm busy every working day, and I know that's the same for a lot of people as well. So we do have to fit around people's lifestyles.
Doctors and nurses should be at the heart of decisions about services.
One of the things that Aradazi has really brought to prominence since he came to join the government has been the importance of getting clinicians involved in making decisions in the health service. And in the North West we've got the Clinical Leaders Network, which puts us in a really good position to respond to Ara's challenge.
We've got such fantastic talent in the North West across all of our staff groups. What a waste if we don't use it. Some of the really best ideas come from the staff. In the future as well, what we're saying is we want that talent in play all the time.
I want a complete package of care.
One of the things that we're doing in the North West is called CATS. It's Clinical Assessment and Treatment Services, and this is trying to deal with the problem we've got now where someone has to go for a test in a hospital, then go back 2 weeks later for a result, then go back possibly for another test, and then another result. And what we're doing with CATS is creating a one-stop shop where you can get tested, get the outcome of that test, understand what happens next. If there's further tests, we'll do them there and then, and this will really improve the experience that patients have with the service.
Our health services must reflect the needs of our community.
Every person's different, every community is different. Health needs vary tremendously across the North West, and we see that on a day-to-day basis. And what we've really got to do is to target the services where they're needed.
So for example, by getting GPs to collaborate, whether that's in health centres or in their own facilities, they can actually bring care that's currently locked into a hospital setting back out to the community. And that's what we're trying to do in the North West, is get these services local and accessible. We're certainly not trying to centralise services.
Work together so that I get the safest and best treatment possible.
One of the things that bedevils the NHS is having a lot of data around the system, but not having that in a single place where we can understand precisely what's going on in the service and use that as a basis to improve things.
One of the key things we're hoping will make the biggest difference is sharing information, working as a team. If we've got access to that information, it's going to make it so much more effective and so much safer as well.
I'm an individual and so are my needs.
Whether you're in a high-tech specialty, in hospital, or you're in general practice, or you're working in the community, if you don't listen to your patients, you don't understand what their issues are, and you don't give them the respect and time to let you know, you'll never address their concerns.
The challenge for us is not just that we get everybody a moderate service, that we can actually make sure that everybody gets an excellent service. And really that means personalising care in a different way.
One of the things that will tell people we've succeeded is when they come along and say, I wasn't a number, I was somebody special, and I was treated like somebody special.
I want the latest and most advanced treatments.
There's lots of ways in which we can use new technology to really advance the care that we offer, and by using technology we can protect local services and we can make sure that that care is as close to your home as possible.
We need to feel the benefits of any changes in the NHS.
What's been really unique and fabulous about this experience is seeing 160 clinicians from across the North West, the public, patients, our partners in different organisations, the voluntary sector, getting together, really debating health and healthcare in the North West. A tremendous amount of energy and enthusiasm and commitment, and really wanting to make a difference.
As we start to move into the next 10 years, we're also very keen that people start to become more involved in the health service itself. We're strengthening our consultation processes so that people know how to get involved in decisions when we're proposing service change. And let's face it, it's their money, it's their health service.